Good afternoon, everyone. This is Caradina Sale with the McSilver Institute, along with the Community Technical Assistance Center and Managed Care Technical Assistance Center of New York State, and I'd like to welcome you to today's webinar, Family Treatment During the COVID-19 Pandemic, presented by Dr. Suzanne Button. This is part 2 of our two-part offering, so hopefully you joined us last week where Dr. Susie Button took you through building your skills as a contextual coach and really talked about interventions around family therapy and different strategies and skills. And then she offered you to, participate in some homework and join us today for the practice report. So we're really excited for you to join us. And if you weren't able to join her first webinar, you can find that on our website, ctacny.org. As a reminder, Dr. Suzanne Button is a policy fellow at Shape & Hall, where she supports effective organizational implementation of TCOM, which stands for Transformational Collaborative Outcomes Management. And she does this in diverse mental health, social service, and educational systems. She has consulted, trained, and published nationally on subjects as effective EBP implementation in public service systems, the use of CANS in treatment planning, and TCOMs, the use of technology to transform clinical practice, and the infusion of collaboration into work with marginalized children and families. Dr. Button has provided family psychotherapy and supervision in her private practice in Dutchess County, New York, for more than 20 years as well. So you're in very good hands with Dr. Suzanne Button. As a reminder, everyone is placed on mute. We're going to ask you to use the chat box a lot today, so you will be chatting in questions and comments, and that's how we will be communicating with you. When you do that, please send to all panelists so that we can see your answers. We don't send to all participants because we want to make sure that our presenter can see all of the answers and replies right away, as well as the questions. So thank you so much for joining us. Without further ado, I'll pass it on to Dr. Button.
Welcome everybody to part 2 of this webinar on figuring out ways to support the children we serve through coaching of family members, caregivers during this challenging time. Before we get started today, I just want to tell you all to hang in there. I know that the work that you're doing with kids and families is so critically important right now, but I also know, because I have my own private practice up here in the Hudson Valley of New York, which is where I live, that it can feel particularly challenging figuring out creative ways to reach and support the people we serve. So hang in there. The work you do is so important. Today I want to try and focus a little bit on 2 primary pieces of follow-up from last week's webinar. I want to recap what we talked about very quickly, but mostly I want to hear what your questions are or were following that webinar, and follow up a little bit on the homework that you tried. What questions emerged from trying out some of the strategies that we talked about? And also, equally importantly, in last week's webinar, we had so many people on the webinar, and lots of folks were sharing really great ideas and strategies. And so I want to try and save some time today to share some successful strategies that you have either tried coming into the webinar series or since you started with the webinar series. What are some of the ways that you're finding reaching families to be effective in this virtual environment? There are a lot of us, so we're going to try and use that chat box function to sort of focus in on some of the most the repeatedly occurring questions and wisdom strategies, okay? So let's just quickly recap what we talked about last time. We talked about this idea of being a contextual coach, right? So it's taking a family therapy stance and trying to figure out how to coach caregivers to implement successful ways to shape their child's behavior. We talked about how the evidence base gives us a lot of great strategies that translate well into role play and rehearsal, which is a great coaching approach. So we looked at strategies for oppositional behavior. We looked at some of the evidence-based strategies for self-injury, right, for when kids are self-injuring. We looked at evidence-based strategies for bedwetting that would translate well into contextual coaching as well, right? And we also took a look at anxiety, obsessive thinking, and behavior. What are some of the strategies we can teach caregivers and rehearse with caregivers that will help alleviate the impact of anxiety and obsessive thought and behavior on a child's functioning? We looked at what I referred to in the last webinar as a roadmap for this contextual coaching, right? Some basic steps that we can walk through to support families and introduce strategies. Listening, supporting and validating caregivers' emotional reactions, framing problems systemically, using things like circular questioning to help people think of the interactional components of behaviors, and using education about how simple changes are hard to make in families but can make a real difference, and then offering a menu of possible strategies that the parent can choose from based on where they're at, what feels doable, and what feels right? And then launching into a role play where you're the parent modeling the skill and the caregiver gets to be the kid and shows you how to do the skill. Debrief on that role play and then choose next steps collaboratively with the caregiver, remembering to educate the parent that things often get worse before they get better when a caregiver changes behavior. And then moving on to another role play with you as the child and the caregiver trying out the new skill. Debrief and decide on next steps. This might all happen in one session. It might happen over 3 sessions. You're going to use your terrific clinical skills and judgment to figure out the best way to implement this roadmap. We also talked about really breaking down focal skills that you can teach that help. And we thought about thinking about strategies that help parents change their own behavior in ways that will impact the child, and also strategies that can help parents change their child's behavior, right? Both are very impactful when we're coaching a context to be more supportive and effective with a child. And then at the end of that webinar, we asked you to choose one strategy from that list for a child and family that you work with and bring it to your work with families, right? And so we wanted to hear a little bit from you about what might be helpful, what was helpful and what questions that you have. We did have some questions from the chat, right? And we can go through the answers to those today. While we're going through these, what I'd like you to do now, if you can, is to start chatting questions that came up. I want you to hold your successful strategies, the things that went well, to a little bit later in the webinar for that portion of the sharing. But right now, if you could just chat in some of the things you'd like to have me address in terms of questions that arose from the last webinar or from your homework. In the meantime, while Cara and Connor are looking at those questions, I'm going to go through some of these. I took a look at all of the questions that came up through the chat during our last webinar, and I summarized the most repeatedly occurring questions, and I wanted to address some of these but while we're getting your questions chatted in today. First, people asked me to define the definition between a coach and a therapist. Well, a family therapist really is a coach. There isn't a huge difference. But when we're thinking about contextual coaching, we're taking that family therapy stance. We're thinking of ourselves as a therapist for the family, for health and well-being, focusing on the health of interaction, right? But when we're thinking about coaching, we're understanding that process is a little bit harder to do virtually, and so we want to focus on strategy. So a coach really helps folks identify a strategy that they want to implement, practices that strategy, and then helps follow up on the success or challenge associated with that strategy. I was also asked to address how bedwetting would be worked on with older youth. So it's important to remember, we talked about debunking the myth that bedwetting is solely caused by anxiety. Now, children who've had issues with bedwetting previously can regress even in middle school and adolescence under stress. And so managing stress becomes more important with older youth. But stress and anxiety should not and cannot be the sole focus of bedwetting, even with older youth. So we want to think about sleep patterns. Sleep patterns can change in adolescence, and kids can regress around bedwetting if they're having increasingly deep periods of sleep. We want to think about sleep apnea and snoring, because sometimes sleep can be irregularly shallow and deep as children get older, right? And so we want to think about any possible sleep issues that might be getting in the way of waking up and using the bathroom, right? And so again, scheduled waking becomes a successful strategy. But we also want to make sure and bring a pediatrician in, right? Because bedwetting in older children can be a sign of neurological issues, bladder or kidney issues, or even spinal issues. And so we really want to incorporate a medical professional's input. We also had questions about finding privacy in overcrowded spaces. And I want to talk more about that when we get to the wisdom sharing portion of today. But I want to focus on the fact that finding privacy and using tech really works better when we use collaboration, right? So talking with families in advance about what tech works best for them. They may not be able to do a visual with us. They may prefer the phone. Using safe words, right? Have a code word that you use that you can develop via email or text or whatever communication that says, I don't have privacy and I can't talk safely right now. It could be the word squirrel, right? But let's talk a little bit later about finding privacy and collaborative use of tech. Someone also brought up working with caregivers who don't know, they don't give you information, and caregivers who've tried everything. And I want to emphasize that when caregivers are not sharing information, or when caregivers are expressing that I've tried everything and nothing works, these are frequently experiences that the caregivers are sharing with us that are associated with the need for trust building and for validation of their level of parenting stress. And so those kinds of responses have to be addressed as relational responses. And so we want to think about building trust and validating. And then we also can use those circular questions that we talked about last time, questions that ask caregivers to think about the interactions to help caregivers see things differently. And I'm going to give you some resources to follow up on that solution-focused questioning style a little bit later in today's webinar. And we talked briefly about them last time. Folks asked about working with children who have safety risks in the virtual treatment environment, right? Now, those are questions that are very challenging in our current climate. So risk assessment and safety planning are critical skills for the virtual therapist, right? And remember that anything that we would do to help a family manage routine, functioning, and safety in the home environment, right, would be focused on the pre-aggressive episode, right? And once we get into knowledge and awareness of ongoing aggression and assault, we move into safety planning, right, and responding to risk. And so those are two different approaches we want to be thinking about. And finally, someone asked me about how do we plan routines during online schooling with younger children. This is a complicated question. It's a great webinar topic for a future webinar, but I wanted to just sort of talk a little bit about some resources for you to dig into, right? When we think about routines for online schooling with younger or multiple children, we want to help families with the idea of loose structure, right? So we don't want to focus on how are you going to get your kid to do school so much as we want to focus on helping families structure the environment in a way that works for them, right? What's a time of day? How can they take turns with kids? What are the ways that they can implement fun and structure and have, right, developmentally appropriate expectations? So those kinds of resources are all over the web. And I want to just point out that ChildMind has terrific specific resources for building routines during this virtual time. Now I'm seeing some questions start to pop in on the chat, and So, Kara, maybe you can sort of help me by pointing out something that you see that's sort of recurring in this question list.
Sure, absolutely. We have quite a few questions, some really great questions, actually. So I'm going to start asking a few, and then we'll just keep going from there. What would the kids do in family therapy when I do a role play with a parent in family therapy virtually? So if everyone's present, they're wondering what the kids would do.
Well, so if everyone's present and you're doing a role play, you would probably want to switch to an enactment. And so what I'm proposing, right, is that we try and get some time with parents where we help them implement strategies and we work with them individually. If we're going to shift to having the kids present all the time, then we might want to do a little bit of interactional coaching and develop an enactment, right? An enactment is a more direct version of role play and rehearsal in which we introduce a topic and we talk about how it goes with kid and caregiver, and then we assign strategies to each person, right, and help them do it differently. And so it becomes a little more complicated, right, but we would just do that as an enactment. So that's how I would handle that.
Great, thank you. That's very helpful. Here's a question I think maybe some people can relate to a lot. This is about one parent in particular that this sounds like this provider had the issue with. The issue I had was a parent who agreed that she needs help could say that she has room to improve on her relationship with her child, but then would continue to avoid any outside intervention, refuse assistance, and act as though she knows exactly what she needs to do to help her kid, the same thing she has always done. How does one get the parent to really see and admit their own patterns?
So that's a really complicated question.
Mm-hmm.
The first thing that I hear in that question is a lot of strong feelings on the part of the therapist about the parent. Understandably, right? That when we get frustrated and we feel like we're hitting a wall with a caregiver or a parent, it can feel really difficult to figure out where can we intervene. And so the first piece I would say is that when I'm feeling that frustrated with a family or a caregiver, I seek some individual supervision from my supervisor, a place where I can feel validated, where my level of frustration can be supported and responded to and held by someone who is a mentor and a teacher for me. So that would be step one in this particular example. Step two is I would try and think about the getting to admit as a goal that would be off-putting for most of us, right? And I hear that as a sort of a framing of a goal that may come out of our frustration. But if I sort of flipped that around and said, well, I'd like to get you to admit that you're so frustrated with this caregiver that you can't think creatively about strategies, that would feel very pathologizing and blaming and make us feel defensive. So we might want to shift that to a more compassionate and an empathic way of thinking about the caregiver. And there's a way to help ourselves do this. We want to think when we come up against working with a caregiver for whom we don't think we can make any progress or any headway, we want to think about what the caregiver is trying to achieve, right? Because just like kids, caregivers do well when they can, right? So for this particular caregiver, I'd be very, very curious about what her hope is and what her goals are around knowing what she does and not changing what she does and not looking at her relationship with her child as being problematic. What is she trying to accomplish with that position? And then once we identify that, so say she tells you, well, I took care of my mother when I was a kid. I never felt like she was in charge. I always felt like I had to be in charge. And I want my child to know that I'm on top of things, right? Then we know that the healthy striving that the caregiver has identified for herself is she wants her child to feel protected and cared for and not parentified, right? So say that's the healthy striving we come up with in conversation. How would we come up with that? We would ask this caregiver Tell me more about what works for you in your relationship with you and your child. What are the things that are really important for you to hold on to in your interactions with your child? I actually dig into that place where you feel her holding on and resisting and learn a lot more about that. Get a lot closer to her around that area. And once she identifies the healthy striving, then I would start trying to introduce strategies that could help her accomplish that very same thing. And in all of this, I might actually stay away from insight as my primary goal. Insight is not an effective strategy for everybody, and not everybody has to have insight before they can change their behavior. So I would move to that healthy striving and try and develop strategies with mom that would help her stay in that place of feeling competent and masterful and in charge.
Fantastic advice. Empowering our caregivers and validating them goes so far. Thank you so much. We have a few questions that are talking about what do we do when the child is refusing to meet with us?
The child?
Yeah.
The child. Well, so this is a family webinar, right? So I would be saying two things. First of all, if child is refusing, that's a key opportunity to get in family coaching, right? So I would focus on that. Secondarily, I would get creative about engaging the child, right? So what I'm finding in my private practice is that this is a new way of working for many kids, and that coming on screen feels really difficult for many kids. And so we may have to use exposure strategies, right, to get kids ready to be on screen in this virtual environment. So we might need to talk with them on the phone. We might need to send them a letter. We might need to ask the parent to show us a piece of their artwork or share a piece of artwork with them. We might need to step up the child to being ready to do virtual work. And if the child still refuses after we tried those kinds of strategies, then we may need to revisit that idea that we talked about last time, which is if we focus hard on systems intervention, we can trust that we're impacting the health and well-being of the child, right, until the child feels ready to get back on the screen. The other thing to think about is that you may want to really change, just as we're telling families, right, change your expectations. Shorten the time that kids are expected to participate in school. Loosen up a little bit on your usual standards around screen time, right? Be a little more forgiving, because this is a tough, stressful time. As therapists, we want to think about the kids we serve that way too. So we may want to sort of let go of the therapy frame for a little bit and just ask the kid to come on screen and play with us. Or we might want to put some puppets up and do a little puppet show for the kid and have the parent just show the screen in the living room and we do a little puppet show. We're just doing anything that we can to get the children to interact comfortably with this new environment, right? Think about it. We're all struggling, and I think after 2 months we're coming to some comfort level with this new way of working, but kids may not be there yet, right? And therapy may already be being an identified patient, getting therapy that may already be a loaded issue, that the routine of coming to your office, right, helped them work with. Now you have to develop a new routine with them. And the other piece I would say is if you can, right, routinize your appointment time with the child to a time of day where the parent or caregiver says their functioning is strong, right? We often, right, in our office visits, we schedule it around kids' school and we schedule it around family scheduling and transportation demands. Because everybody's at home, it might be possible to schedule it when the kid is at their best, which is different for different age groups. Other questions?
Great. Thank you. We have a question here, I think you sort of attended to it, but somebody asked specifically, what do you do when the child says they're too embarrassed to do the role play?
When a child is embarrassed to do a role play, right, So I'm wondering about that question, because so we may have a child that we're individually intervening with, and that child doesn't want to do a role play, right? So in that particular instance, I use the same thing I just described to ease kids into a role play, right? So you may do it in a silly way. You may do it in a sparring way. You may tell a story about another kid who's in that situation, right? You may use puppets if it's a younger child and do the role play with the puppets, okay? The other thing you can use sometimes when a kid won't do a role play is you can use some sort of a drawing, right? So you could put up a little chart and ask the kid to point where on the chart they would feel scared if this happened or that happened, right? So you have to ease kids into role playing with you in general. You have to do that in therapy, and you have to do that virtually. When you're talking about family therapy, if you're doing what we would think of as a role play between family members, we don't call that a role play. We call that an enactment. And that's a different intervention that we haven't really talked about in depth here. We certainly could in another webinar. In that case, right, we try and create the situation where the thing that the family needs coaching around is happening in front of us on the screen. That is a trickier intervention to do virtually, and that's why we're starting with this straightforward coaching and rehearsal with the caregiver individually.
Excellent. Yes, perfect. Someone is asking, how do you sell the idea of process over content when content feels so important to parents and youth?
Well, nobody on this call is going to like this answer, but to be honest with you, I don't. So when we think about the idea of process versus content, right, that really is, in the history of psychotherapy, that concept comes from an individual psychotherapy frame, right? And while it is certainly true when we're dealing with families, getting families to think about process isn't necessarily going to get us the most bang for our buck with them. Families are focused on content because they want to see their child doing well in life, and so they're focused on behavior, right? And families are focused on content with us because just the process of talking about our feelings is not what many of them consider to be effective therapy. So when I'm trying to get a family to work differently, I focus on content. I focus on what they'd like to see be different. I focus on educating them around strategies that might help things be different. And I myself track process only to the extent that I know better how to be strategic and how to help them be strategic. And so I don't actually try to get families to think about process. I do, however, use circular questioning strategies, use systems thinking to get families to think about interaction. And that is the closest thing you're going to get to process with most families. And it's very successful. If you can get families to think, well, when I do A, Johnny does B. But when Grandma does C, Johnny does D. That's really a meaningful way to translate process into family life.
Fantastic. Thank you so much. I have a question here about supporting parents that are co-parenting. They're in separate homes, and there's some oppositional behavior stemming from estrangement due to previous incarceration. And the parents are not fully collaborating on any given strategy, and they're also kind of communicating separately with their teenager. What would you recommend that can be done with this family?
I'm going to answer the question, Kara, but I missed one piece. You broke up a little bit. You said that estranged due to incarceration. I didn't quite understand that part. Can you read that again?
So they're co-parenting in separate homes, and there are oppositional behaviors that are happening in the teen. It seems to be stemming from previous incarceration from one of the parents. And the parents are not fully collaborating on any strategies and also not fully communicating with each other or their teen.
Mm-hmm. Well, so first of all, one of the things I always like to start with separated and divorced families is this idea that different family structures in different homes are okay. And that what we know from the research around this is that actually kids can and do adjust to different parenting strategies in two different homes, right? So the goal of getting parents to do the same thing in two different homes is not necessarily a useful goal. So that's number one. That's one assumption that we want to take. So what that means is that we can actually take on each household separately as the family therapist and help maximize the interaction and functioning in that individual household. So that helps us, right? Rather than trying to get separated or divorced parents to collaborate with one another and do the same thing, we get each parent to define what works for their household. So that's number one. Number two, I also want to normalize the fact that most children exhibit some form of behavioral regression when they transition from one house to the other in the early phase of a divorce or separation. So often that is interpreted by therapists as problems with different rules, when really what it is the child showing how they feel, right? And so that's okay, and that can be normalized to a certain degree. And then we're adding on, right, a sort of a developmental issue with one family, which is that one of these parents was incarcerated, and the child and the parent need support around reattachment, reconnection, and establishing of new routines, right? So that starts to point me in the direction of a strategy, right? Education around what's normal, collect information around what needs to happen next, and strategies that help those two start to develop their own new routines that work for them, right? So that sort of helps us separate and sort of simplify our strategy. Now, you didn't say that there was overt conflict between these two households, right? We do know that open conflict between two separated or divorced parents has a tremendously negative impact on kids, right? So and we also remember that family therapy has been found largely to be contraindicated for separated and divorcing couples, meaning when you bring two people together into a family therapy context and try and get them to talk about their feelings, right, it's contraindicated when they've already decided to divorce. So what we know is that coaching each parent individually and separately how to manage their validated feelings about the other parent in front of the kid is the strategy here. So that's a lot for one question, but those are some of the ideas that I'd be running through in my head as I approach that situation.
No, that was wonderful. Thank you. We have a question here about caregivers in the family, working with the family, and caregivers don't know any other way to answer a situation other than yelling. What can this provider do best for them?
Well, again, when I hear that a parent doesn't know any response other than yelling, I want to get curious about what that parent knows and doesn't know. I want to get curious about my own frustration with the parent and my worry for the child. And I want to sort of settle down a lot of that emotion and then come back at this work with a little curiosity about that caregiver, right? So I'd want to spend some time talking with that caregiver about what's accomplished with the yelling, what the healthy striving is around the yelling, right? So I know for myself as a parent that when I yell, I tend to yell when I'm afraid, and I tend to be afraid around the things that I don't want to see for my kids that I had to struggle with as a young person. We all have versions of this that trigger us as parents. And then on top of it, right, we all have different levels of capacity to self-regulate when those feelings of frustration or fear hit. So again, whenever I find myself struggling with a lot of frustration about a parent, and whenever I hear a therapist talk to me about feeling like that's all or never right? Always the way this caregiver responds, this caregiver doesn't know any other way, will not respond to me. I think the therapist needs some support around their own stress and then needs to try to get close to that parent again and find out more about what they do know, what's getting in the way of what they're trying to accomplish with the yelling, and what are the self-regulation skills that can be taught in the direction of supporting the healthy intention of that parent. What does that parent want to accomplish by that yelling?
Fantastic. Thank you so much. You're bringing so much wisdom to the table today. We really appreciate it. I think we have time for 2 more questions, and then we could go into hearing about the homework. How does that sound?
Sounds great.
One question is how to really help parents address parents who are resistant to trying new strategies as they are fatigued themselves.
Amen.
Mm-hmm.
Yeah. Yeah, so this is where collaboration and meeting people where they are becomes paramount, right? And so remember that we talked about, I used to talk about teenagers this way, but in the COVID-19 world, I like to think about parents in this way too, or caregivers in this way. We know a lot of interventions that work, but with adolescents, because of where they are developmentally, we offer them different ideas, almost like a menu, a tray of sandwiches. Here's a tray of sandwiches. Here are lots of ways that we could make things go differently in your life, but what do you want to choose on this tray? Do you want the tuna? Do you want the roast beef? Do you want the roast vegetables, right? What seems like a doable strategy to you, right? This kind of collaboration becomes so critical, right, when we're working with teenagers. It also becomes critical when we're working with families that are maxed out, right? So before the COVID-19, we might have thought of that when we're working with families who are managing multi-generational trauma, lots of socioeconomic stress, right? We might think of often when I'm working with a family that has endured a really difficult loss and they're in an acute phase of coping with that loss, collaboration becomes key. Here are some of the things we could do, but what feels doable to you? And for me, that has become the paramount approach to lead with in this COVID-19. Lots of transparency about how hard this is and how tiring this is, and lots of compassion around if we can just choose to do one little thing differently, what feels doable for you, right? And that way, right, we're sort of continuing the idea of transformation and change while being incredibly responsive, collaborative, and compassionate about the level of exhaustion and the ambiguous overriding stress that we're all feeling right now.
Mm-hmm. Excellent. And this last question to end on, but before we do, there were a number of questions just around children in particular, and I'm wondering, not to answer them specifically, but to remind people how important family treatment can be for kids who are experiencing some challenges. So if you just want to say a word about that.
Yeah, so we talked a lot last time about brain development, right? And that's where I always like to focus. I love to focus on neuroscience to guide myself as a therapist because really, if you think about it, we're there to intervene around that developing brain. And what we know for sure from, like we all knew this before, 0 to 5, we knew that the most important thing about the 0 to 5 brain is improving the interactions that that child experiences. So most of the time now when we're intervening with a child 5 or younger, we really aren't doing our job if we don't take on the family. Well, guess what? We now know that repeated interaction and experience shapes the brain all the way up through age 21 on average for girls, age 23 to 25 on average for boys. That if we are not intervening with the family context, we are missing an opportunity that's far more impactful than the 1 hour a week that we have with the child. So we want to take on family intervention. It can be challenging, it can be hard to do, and it can feel very complicated, but we get so much impact for the child whose life we're trying to help transform when we do that.
Thank you. Thank you for that reminder. And so this is the last question we'll end with: how to manage family therapy when the more involved functioning parent was lost to COVID?
Well, I think in that particular case, we're going back to a much more extreme version of what we just talked about, which is that there's a parent who has endured a terrible loss, and there's a child or children who have endured a terrible loss. And so we need to then focus family therapy on a real support for where they're at in any given moment, right? So we want to focus on validating the grieving that everybody's doing. We want to focus on helping the caregivers support the children in that grieving. And we want to stay really small and simple with any strategic goals, right? The best thing to help caregivers with in that situation is to help them understand the impact of grieving on the family, on them, and then to help them, right, choose really small, doable goals. Remember, when we look at the literature on loss, we know a few things. When someone loses a loved one, an adult or a child, when you lose a loved one, you go through anywhere from 3 months to a year of impaired cognitive functioning, meaning your memory is poor, your ability to stay focused and follow through is poor, right? And your ability to learn new things is poor. So we want to get really simple with families who are enduring loss and do a lot of supportive work around the loss and help them develop maybe one goal as a family that can help them get through, right? It's a very different kettle of fish, and we want to move off strategy and move on to support in really small steps, one at a time. So, Kara, I think we have about 19 minutes, and I wanted to get some homework reports out. I want to have folks really share. Oh, that's actually from last time. But let's start now with maybe sharing some wisdom from the group. How did the homework go? What do you want to share with the group today? And actually, while are you getting chats on that yet?
I have one or two. I have. Did you want to say something else first?
Yeah, let me just say that while folks are chatting in their practice reports, and we're going to go around that, and please, in your practice reports, chat in what went well, but also feel free to chat in some strategies that you came up with or that you've been practicing that have been helpful for you, so we can share them with everybody on the call. There are lots and lots of people on the call today. Here are some of the strategies that people chatted in from last time that I thought were really beautiful, and I wanted to share them with all of you. Someone talked about doing a safety planning virtual tour, having the parent walk around the home or the apartment with a phone or a computer with the screen turned around and taking a look at safety in the home for a child who's at risk. Another person talked about reminding caregivers of practicing special time, right? That one-to-one time, even if it's 15 minutes before the baby wakes up or after the baby goes down. Someone also taught a really beautiful example of how to teach parents to shape their child's behavior using the example of getting your child to eat a carrot, right? How do you break down changing a child's behavior by using a very simple day-to-day interaction? We've talked a lot about circular questions, and I'm going to share a solution-focused website with you today at the end of the call. Taking the parent outside for role play, rehearsal, and coaching gives them some privacy, but you're also actually getting them to do self-care and showing them how self-care and taking a break can help. Lots of people talked about developmental education from parents, using this virtual time to give parents little lessons on what's developmentally appropriate expectations. And so now I'd like to hear from you about some of the things that were helpful and that you can share about your homework, and we'll share them with the group.
Great. I'll share a few comments that we got early on. Someone said that we did a short phone survey with families. It was a great way to find out what their wants and needs were at this time, and it really opened the door to more discussion.
Oh, that's a great idea, right? And so that really brings home this idea of collaboration, that when things get hard, we go to the clients for wisdom. And the more we ask them for wisdom, the more doors open and the more ideas come up. Great one.
Mm-hmm.
So that was a survey that the agency did with families, right? That's terrific.
Yep. Yeah, I know. I wanted to share that. I thought so as well. Somebody else shared you can use a PCIT bug in the ear technique with parents or caregivers when all family is present, especially with AirPods. They're really doing the coaching via the caregiver and an ear pod.
Oh, that's a great idea. I kept feeling tech phobic, and I never even thought of that. But that is a great idea, right?
Yeah.
So remember, right, we talked earlier, and we didn't talk at length about this, but when you're going to do something like that, you want to spend at least a half a session collaboratively preparing to use the tech with the parent, right? Have them practice with the earbud, talk about what it's going to look like, right? But that is a great idea. So in other words, what we're saying is we're going back to that question about, well, how do I do role play if everybody's present? Well, one great solution that you came up with in your group is put an earbud into the parent's ear, watch them interact, and give them coaching through that earbud that the child isn't hearing. Great suggestion.
Yeah. Yep. So some people are sharing their homework experience now. Someone said they had a great deal of difficulty convincing the parent to engage. The parent simply wished to have the child fixed and changed. And I know you spoke a little bit about this during the last webinar, but if you had any other thoughts to share there.
Yeah, I mean, I think what I always rely on in situations where parents want me to fix their child are two really core strategies. The first is validation, right? When someone is telling me, I don't want to do it, I just want you to fix my child, what I'm really hearing is a lot of exhaustion and stress, right? And so, right, often people say, I can't live with this kid anymore, I can't do this anymore, I don't want to deal with this anymore, right? Any of those kinds of communications are a reflection of how hard it feels right now to parent and or to parent this particular child. So that's number one. But number two is also, right, this idea of saying, of course you want your child to behave differently. And of course it's really hard. And I'm going to do my best, but I know from lots of time working with kids and families that I'm nowhere without you as a partner. And do you know why? Because I know a lot about how to help kids change their behavior, and you know a lot about your kid and your family. And if we don't combine those two sets of knowledge, we're going to be not effective at all. And those two stances generally over time really help build family involvement. And remember, using those systems questions and just avoiding the power struggle and saying, okay, great. So in order for me to work more effectively with Johnny, I do need to hear a little bit about family interaction. Do you mind if I ask you some questions about places where he's more oppositional or less oppositional? Are there things that are going on in the family when she cuts that you've noticed? Like, are people more or less stressed? Are you having meals together, and when do those meals go well? And does she tend to eat well at meals and then binge later in the day, or does she tend to, right? So starting to ask those circular questions. Who's the boss in your family? Who's in charge, right? These kinds of questions start getting families to think about the system, and you can do those as part of your assessment and then come back to them later when you've built trust to start working more on intervention. Great question.
Thank you. That was very helpful. Someone shared that they were able to work on a safety plan with the youth and the foster parent as homework. So that seems like it went well. Mm-hmm.
And that's a great example of a concrete strategy, right? So even though we may be worried about process and how the relationships may increase risk, we go into strategy. Let's talk about safety planning. Well, guess what? Getting folks to think about safety strategies can shift the way they interact with one another.
Mm-hmm. Someone shared that they were able to use the interactive whiteboard feature while on Zoom and kept track of their responses on a flip chart, which seemed to help engage the family and give them the ability to clarify if there was any misinterpretation.
Well, that's great, right?
Mm-hmm.
So you can use the tech functionality of the platform that you're working in, right, to engage the family. And that also speaks to an earlier question, because if a kid doesn't want to participate with you, maybe they'd want to participate in just looking at a whiteboard and thinking about ideas. That's a terrific strategy. I'm stealing that.
Yeah.
You said that, I'm going to steal it.
Yeah, some very talented people. A strategy that was helpful for my new case was that I conducted what's called the FAST assessment, functional assessment screening tool, and collecting ABC, antecedent behavior and consequence data via phone or video. This helped to identify what was maintaining the problem behaviors of the child, as well as the settings that it occurs in the most and with which people. Having this information has helped me to advise the caregiver to modify the environment and the persons in the environment to see if it leads to a decrease in the behavior problem.
Oh, that's beautiful. So what I hear there are a couple of things, right, is that you broke up your assessment into different ways of collecting information. And then I'd be curious about how you presented the information back to the caregiver, because it strikes me that the tech functions could actually be a nice way to collaboratively share that data and then choose next steps. That's a great approach.
Yeah. Then somebody else shared that the homework didn't happen for me as the client didn't want to talk to me, but I was able, it sounds like a grandmother and child are in therapy together. This person reports, however, I was able to talk with the grandmother regarding what works for her around handling the child's upsets.
Oh, great. So that's a really strength-based way to talk about interaction, right? And build on what grandma already knows how to do well.
Yeah. Someone else shared that I participate in the activities with my kids and parents so that we all look silly, and that usually helps to break the ice. They wanted to share that, which sounds very helpful.
Really, always remember, a one-down position with kids and a one-down position with families can relax them and help them feel better in a new environment. And whether that's your office or a Zoom screen, that goofiness can really break the ice.
Yeah. What I have shared with my parents the benefits of creating a visual schedule and visual expectations along with rewards of meaning, for example, special time with a parent or some kind of activity together. Great.
And I also, someone said here, the visual schedule is one idea, and then someone else said they use the sharing option to work on worksheets. And so the theme here is, what is the information that you can put up that speaks to the behavior you're trying to help shift, right? So the virtual schedule, right, putting up an Excel spreadsheet or a template and filling it in with the caregiver, right, that can help them schedule the day. Putting up a worksheet, putting up an assessment tool, all of that is nice and transparent and gets the caregiver thinking with you about the information that you're thinking about. Oh, that's here's another one, right? Recording the Zoom meeting. And this is a PCIT strategy. Someone's talking about recording the meeting and then helping family members look at the video later and point out each other's body language and response and give each other coaching and feedback, right? So that's a terrific way to collaboratively have the family coach one another. Beautiful. A great strategy.
Yeah. I think that's about all of the experiences. Did anybody else have any any homework experiences that you want to share? There are a lot of different strategies you're sharing and successes around virtual treatment with families. That's fantastic. I think that's really helpful for others to hear.
I see.
Is there anything else?
I see another one in the chat. This is a terrific one. When a family member has to get up and walk away, and that happens on Zoom, right? Someone has to go to the bathroom or get the baby, or they go get a drink of water. Asking another family member or the remaining family members to play the role of that person, right? So that's a way to get people to start thinking about and being in an awareness of the family as a system. Beautiful. It's another great strategy. So I want to sort of wrap up today. I'm going to skip this slide and talk you through some resources. I've added to the resources we put up on the last slideshow. But, right, I want to point out a few really helpful pieces, right? The American Association of Marriage and Family Therapy has terrific courses on conducting family intervention, right? These courses are for all levels and at all levels of cost and simplicity. And so it's a really terrific place to go if you want to develop your skills as a family therapist. ChildMind is a resource that is there for kids and families. But for me, sometimes when I need a quick memory refresh in a busy day to focus in on a particular set of struggles, I'll go to ChildMind and read what they say to parents to just remind myself of the evidence base, right? Particularly the strategies around working with aggressive kids or kids with self-regulation issues are really, really helpful, right? I saw some questions out of the last webinar about how do you work with kids who are having aggression issues and self-regulation issues. The strategies on the ChildMind webpage for parents are terrific. Also, there's a place called the Zor Institute that gives you lots of different resources and links around family intervention, right? If you have a little more time and more resources and you want to take a course for a fee, you can dive deeply into family therapy through psychotherapy.net. Interestingly, many of the family therapy YouTube videos that you pay for on psychotherapy.net can be found by searching for the particular kind of family therapy open on YouTube. So if you, for example, go to YouTube and say, solution-focused circular question family therapy, you'll get a whole bunch of videos of masters of circular questioning and solution-focused family therapy, and you can watch them there. And particularly when we're thinking about getting families to move from a stance of, I can't do it, you fix it, I don't want to change, I'm stressed out, we want to go to solution-focused strategies because those are the most effective, not process-oriented strategies and not power struggle-oriented strategies, but finding a common focus around a solution. And the Solution-Focused Net is a terrific resource for you to learn more about circular questioning, staying out of power struggles, and finding common goals with caregivers. So I really want to emphasize that there's lots of stuff out there to give you some supports in this really challenging time. And I also want to really appreciate your wisdom today. So many terrific strategies, lots of good risk-taking with this virtual Zoom or virtual GoToMeeting or whatever the platform is you're working on, and lots of great strategies, some of which I am going to steal from you. So thank you so much.
And thank you, Dr. Button, for being with us on 2 webinars now. One, to share amazing information around building caregivers as a contextual coach, as well as this practice opportunity and Q&A with you. I think this has just been so incredibly helpful, and we really appreciate your time and your expertise. If you could just go to the next slide really quickly, I just wanted to share some upcoming events for CTAC. We have many things happening in CTAC, as you probably know. On May 14th, we have Leadership in Times of Crises, Building the Skills for Successful Leadership. We have Education During COVID-19, What You Need to Know to Protect Students' Rights. That's Friday, May 15th. We have Best Practices for Supporting Teen Care Families in Community Settings on Tuesday, May 19th. And then Supervisory Best Practice Series, The Critical Role of Supervisors as Change Management Experts on Thursday, May 21st. Hope you can join us for those offerings. And most importantly, please take good care of yourselves, and thank you so much for all of your hard work, as you are unsung heroes. We really admire all of your hard work and dedication to families and kids, especially during this time. Dr. Button, any last words?
Well, I just want to second that. You all take good care of yourselves. You are caring for the hearts and souls of the kids and families we serve, and we really appreciate you for it.
Yeah. All right, everyone. Have a good day, and we hope to talk with you soon. Bye-bye.